everyone, I'm Leanne Moyer. I'm the owner of Portland Mom Collective, and I am here with Dr. Sanjeev Jain. We've done a couple Q&As now, but Dr. Jain, would you mind introducing yourself a little bit for people who might not have seen them?
Yes, so my name is Sanjeev Jain. I'm a physician at Columbia Allergy, and I'm an allergy specialist, and we particularly focus on food allergy treatment and diagnosis. And we have multiple offices in Washington, Oregon, California, and Idaho. And in the Portland region itself, we actually have 5 clinics. So we're readily accessible to whoever who wants to work with us here.
Well, thank you so much for joining us. We're, given your specialty, we're talking about food allergies in kids. So I know that this is it's a growing phenomenon, right? We're noticing it more and more in kids these days. Am I right about that?
Yes, we appear to have an increased incidence of food allergies, and the trend has been going in that direction for the last 20 plus years. So it's not just our perception. I think it is very real that food allergy incidence is going up in kids.
Well, hopefully some parents who have questions about food allergies in their kids can get some information out of this little question and answer that we're going to do. So are you ready for some questions that we've got?
I think I am, yes.
Okay, great. So our first question is pretty straightforward. If a parent thinks that their kid might have a food allergy, what are the symptoms they might see, and at what point should they seek medical care?
Yes, I think any child who's having symptoms of allergy, especially after ingestion of a food, they need to seek medical care, not only to manage the symptoms, but also to come up with the explanation of what food might be causing the problem. And so the typical symptoms we see are hives, which are raised red rash, which can be throughout your body, and they are transient, meaning they come and go, or at least they're not at one location for extended periods of time, and they're typically very itchy. And so if you have those types of hives, that's a sign that the person is having an allergic reaction to something. The other thing we are concerned about are, breathing problems. Some people can have wheezing. If somebody has asthma, then of course that may be a reason for wheezing, but sometimes food allergy reactions can also cause wheezing. The other common symptoms we will see would be cough, vomiting, abdominal pain. In some cases, one may even have diarrhea. So any gastrointestinal symptoms, we need to consider food allergy as a possible cause of that. Any kind of skin rash, we need to consider as a possible cause of food allergy. And then the worst or the most severe type of reaction is what we would call anaphylaxis, where there are multiple organ systems involved, and there may be lightheadedness. Somebody is about to faint. That is a very serious condition, and one needs to call 911 right away if something like that is happening.
Okay, so you mentioned this, that they should come in and find out what might be causing the reaction. So how does somebody do that? What happens at the office to determine the food that's causing it?
Yeah, so for us, the most important part of our evaluation is just taking a really detailed history in terms of what exposures happened, when they happened, and so what was the time sequence of events. We also look at statistics. So, if somebody has a food such as let's say peanut butter, peanut is a bigger suspect in our mind than wheat or other ingredients in the bread, although other, wheat and egg and dairy, and they're all very common allergens. So we have to expand our investigation to make sure we're not missing anything. And then once we know that, we can perform blood testing as well as what we call skin prick testing and see what shows up in those tests. But no test is 100% reliable. And so in many cases, if we're not sure what caused the reaction, we may also do what we call oral challenges, where we would very systematically and very carefully administer the food that we're suspecting as a potential cause of the reaction. So food challenges are considered sort of the gold standard in allergy testing. When everything else has not given the answer, that's what we would use to try to come up with an answer of what caused the reaction.
We had a little moment where the connection blipped out. And so you said, in that moment, you said that food skin prick testing is not always the most reliable, or is not the most reliable?
It is quite reliable. However, it is not 100% reliable.
Okay.
And for that reason, the gold standard in allergy testing is what we would call an oral food challenge, where we actually have the person ingest that food in our office in a very systematic way. It's a multi-step process where initially we give a very small amount of that food. We observe the person very, very carefully. Then maybe half an hour later, we may give slightly higher amount and observe some more. And so it takes a good 3-4 hours to do an oral challenge, but we would conduct it in the office for safety reasons.
Yes, and full disclosure, I have been in there with one of my children doing that, and it is a long process, but it is very carefully monitored. There's people every step of the way. So for parents who might find that intimidating or scary, it is comforting to know that it is under a lot of supervision.
Yes, that is correct.
So let's imagine that a child gets diagnosed with a food allergy. How can parents prepare for, obviously you can try to avoid something that might cause a reaction, but how do parents prepare for moments when they're not around, let's say a sleepover or even school, camps, those kinds of things where a kid might risk exposure?
Yes, so it is a difficult thing to do, no doubt about it. But when the parent needs to talk to all the caregiver of that child to make sure everybody is aware of the child's food allergy. And many parents just choose to provide all the meals for the child and instruct the caretaker to make sure that the child is not eating any other food other than what is prepared by the parents. And so that would be a very good way of ensuring safety. But it depends on individual situations. Certain foods are easier to avoid than others. We see people with allergy to macadamia, and in general, it's easier to avoid than something like dairy, which is much harder to avoid. So it does depend on the allergy itself.
Yeah, that was my next question, was if there are some foods that are at risk of higher accidental exposure than other foods. So what are some that are high risk of accidental exposure? You mentioned dairy.
Yeah, I think dairy is by far the hardest food to avoid. It's everywhere. It's in lots of hidden places. Egg is another one which is hard to avoid. You can't buy any baked good which doesn't have egg unless
Right.
clearly specified. So egg is very difficult. Wheat and other grains are also somewhat hard to avoid. People don't realize that soy sauce has wheat in it, and so so there are hidden sources of wheat as well. These days, nuts are actually easier to avoid just because greater awareness in the society about nut allergy. So in the past, peanut exposure, accidental peanut exposure used to be very common, but these days, all the airlines, everybody's aware. But even then, peanut is also very common in lots of different places, and it is hard to avoid. So so many foods are difficult to avoid, and that's why one needs to be vigilant to make sure that one is not getting, unrecognized exposure to these foods.
Yeah, it is challenging for a lot of people. So let's talk a little bit about treatment. What are the options for children with food allergies or adults with food allergies as far as treating the allergy itself?
Yes, so for the longest time, the conventional approach in managing food allergies was just, strict avoidance of that food, reading labels carefully, and carrying an EpiPen. But that works in many situations. But as we have just mentioned, it is hard to avoid. Accidental exposures do happen with many of these foods. And so that's why since 2007, we have been working on different protocols for desensitization of different foods that the person might be allergic to. And so the basic desensitization process is we give microscopic amount of that food initially, and then gradually go up on the amount until one reaches what we call maintenance dose. And in the process of building up to the maintenance dose, the body develops tolerance to that allergen. And so we were earlier talking about like an oral challenge. Now, an oral challenge is a test where we perform that test over a matter of, let's say, 3-4 hours. In desensitization, what takes 3 to 4 hours in the challenge takes maybe 6 months. And so what that means is we're pretty much doing the same thing as one would do in an oral challenge, but doing it much, much more gradually. And so that's the fundamental difference between desensitization and a challenge, that a challenge is a test, desensitization is a treatment. And that treatment then allows an individual to be exposed to the food that they're allergic to without causing a reaction to that food.
Right. And so they have you said it takes around 6 months to do part of it. And then are they able to, in theory, eat the allergen safely?
Yes. So we look at this desensitization process in multiple milestones. For us, the first milestone is cross-contamination protection. And so that milestone is achieved almost 100% of the time with the different treatment protocols we have developed over the last 15 years or so. The second milestone is what we would call bite-proof protection, and that's sort of a vague term, but it basically means that, let's say if somebody has peanut allergy and they happen to eat a bite of a candy which has peanut, or a bite of peanut butter sandwich or something, they won't have a reaction to that. And so typically when people reach what we would call the maintenance dose in our desensitization program, then at that time they have what we would call bite-proof protection in most cases. And for many parents, that's adequate. That's all they want, because consuming that food is not as important to them as safety. And so if that is their primary goal, then we may not pursue anything more than that. But especially with staple foods such as dairy and wheat and egg and those kinds of things, people do want to introduce it in their diet. And of course, depending on individual preferences, there are kids who want to introduce nuts in their diet, seafood in their diet, or whatever the situation might be, in which case we will move forward with other milestones that we want to achieve. So for us, the third milestone is what we would call free eating status, where they can eat as much of that food as they want to without having a reaction. For us, typically free eating status can be reached within a year or so of reaching that previous status, which we would call the bite-proof protection. But even free eating status is not cure for a food allergy. So the last milestone which we talk about is sustained tolerance, where you truly develop tolerance to that food so that you don't have to eat it every day. You can reduce the frequency, get exposure every once in a while, and that's adequate to maintain your tolerance. And so before one reaches that sustained tolerance status, one needs to consume that food every day or certainly every other day to maintain that tolerance. And so those are the four different milestones that we try to achieve during a desensitization process. The short answer is yes, if somebody wants to really introduce that food in their diet after desensitization, that is very achievable, although not everybody gets there for various reasons.
Okay, excellent. Hopefully that's given some families some ideas about what they can do if they suspect or know their child has a food allergy. If they are interested in contacting you or any of your clinics, where should they go?
Yes, so we have our website. It's called columbiaallergy.com. And once they can go on that website and they can search for the location that is closest to them, and then we can provide service to them at that location.
Excellent. Well, thank you so much for sharing all of your knowledge with us today.
Thank you so much.